So as you're reviewing the material on cardiovascular and pulmonary systems, think about the structures and systems that you need to understand how the cardiovascular system works and why it functions as it does. So you'll need to understand cardiovascular anatomy and physiology, so specifically the heart and circulation. You'll need to understand the peripheral circulation, how all of the arteries, capillaries, and veins work through the body and where they supply nourishment to. And then understanding the basic function of the cardiovascular system, which is to deliver oxygen to organs and tissues, remove carbon dioxide and other byproducts from the body, and also assisting in the regulation of our core body temperature. So as we've told you in the past, and I think you're pretty familiar with, you won't necessarily need to have a knowledge about the structures of this system. You will not be asked specific questions on the structures of the system. However, you will need to understand how the systems impact the client and what that means for function. So as you dive deeper into your readings and you see coronary artery disease or CAD, some of the specifics that you'll need to understand are the risk factors and then our role in education and prevention programs. So when you think about coronary artery disease and atherosclerosis, which is the process that narrows the lumen of the coronary arteries, resulting in ischemia to the myocardium. So basically plaque building up within the arteries that could lead to a whole host of issues for the client, which affects their heart. So understanding the etiology of atherosclerosis and how we as OTs can educate on nutrition and active lifestyles and modifications of activities so that people can engage in the activities that will reduce their risk of atherosclerosis. Understanding signs and symptoms, so the main clinical symptoms of CAD that might require medical attention, specifically angina, also known as chest pain, and the various severities of angina, and understanding what you need to do if somebody is going into some sort of cardiac event. So understanding that if somebody is experiencing chest pain and it's because of an increased demand on the heart to, maybe it's now that you need to reduce that load that you put on the heart versus something more severe where you need to call 911 because maybe they're having a myocardial infarction, or call the medical team. And understanding that chest pain might also be misinterpreted as indigestion. So understanding what the other signs and symptoms are to look out for if somebody is having chest pain. The other area that you need to focus on, and let me see if I can pull it up real quick. And this is in your resources, this is the New York Heart Association classification of heart failure. So understanding what within each class of heart failure, what the person's capability is. So if you see a question that relates to a particular class of classification of heart failure, you understand that at class 1, there are no limitations. They can proceed with their physical activity and they have a MET level of greater than 7. Class 2, they have slight physical limitations, ordinary physical activities might result in increased fatigue or dyspnea or palpitations of their heart or mild angina. 3 and 4, and understanding what those categories look like for your client. Now, speaking of MET levels, so with your MET levels, these are the physical classifications of what a client is able to do based on their cardiac output. So this is especially important when you're doing cardiac rehab. So after somebody's had a myocardial infarction or an open heart surgery, also known as a CABG, coronary artery bypass graft, you understand what physical activities they're able to engage in based on the functioning of their heart, based on their MET level. So you know if they're at MET level between 1.0 and 1.4, they're able to do self-feeding, they're able to wash their hands, able to do light tabletop activities. And then as they move through these MET levels, you understand that they can do seated bathing, but they can't take a shower. When they get to MET level 2, they can do a seated shower, but they can't do standing shower because it's too much exertion on their heart. So you need to understand these MET levels. Now, we understand that memorization is not everybody's skill. You all know that memorization is not one of my skills, but picking out 1 or 2 activities that you know at those MET levels a client would be able to do might help you understand a question when it comes up. No precautions and complications, so your external precautions, complications related to when somebody is in congestive heart failure. You do not do retrograde massage, as it's pushing fluid towards the heart that's already overloaded with fluid. So if you go back to when we were talking about system disorders, specifically the renal, genital urinary system disorders, and we talked about people who might need Lasix to flush out excess fluid. Kind of a similar concept. Now it's the heart that has that excess fluid. They might also be on Lasix to reduce that fluid overload. So understanding what that looks like and going down to understanding prescription medications, what those medications look like and how they impact the body. Understanding just the etiology and how a cardiovascular system disease is diagnosed, how what its onset is, what its prevalence is, and its etiology. And really all of that will tie back into the education and prevention programs for health and wellness that we do as occupational therapists. Understanding the clinical manifestations of peripheral vascular disease, as we learned from our prosthetics lecture, that PVD often is directly another reason why clients have lower extremity amputation, because there is an occlusion of the peripheral arteries related to atherosclerosis. We go back to diabetes and renal diseases, how all of those conditions work together to create this coronary artery disease. And then you've already had your lecture and fieldwork on lymphedema, so knowing the causes and the stages of that. Pulmonary system and dysfunction, understanding the signs and symptoms and functional implications of the disorders. So, you know, when we're thinking about energy conservation, we're thinking work simplification, we're thinking adaptive equipment, we're thinking DME, we're thinking teaching pursed-lip breathing. We are encouraging breath and respiration so that our clients can be more functional within their abilities. We are understanding oxygen, when people are getting oxygen therapy, through a nasal cannula, how much oxygen, how many liters of oxygen that they're getting, why they need it, and how the oxygen is then moving through their system, and also recognizing that we as therapists do not wean people off of oxygen that's been ordered by a doctor until we have an order from the doctor to wean them off of the oxygen. And what our role is with building up endurance, building up strength. We're not necessarily talking in our goals about distance of how somebody can walk without shortness of breath or dyspnea upon exertion, but we're talking about functionally, what are they now able to do based upon how much further they're walking, or how much more energy that they have, or how much more time they're able to spend off of the oxygen while we're facilitating weaning them off the oxygen. So if you have any other further questions, don't hesitate to reach out, and I will talk with you all soon.